Assalamu alaikum everyone and welcome to this career guidance session and thanks for attending this session. My name is Naveed and I'm a 2013 graduate from MBBS batch and I will be presenting you a presentation on PLAB Guidance session. Currently I'm working as a junior clinical fellow at St. Mary's Hospital, Manchester. So most of you when you will start working here in the UK, if you are willing to do so, you will start as a junior clinical fellow or an SHO post, or sometimes they call it specialty registrar. So these are the common names. If you are not going to start as a registrar, you will be working in the same post. So once again, thank you for attending this career guidance session. And at the end of the presentation, I will take questions. So if you have any questions, please ask me. So, when we talk about PLAB and UK, the first thing which comes to mind is why should we go for PLAB and UK option? Because after completing MBBS, most of you have different options available. Like you can go for US MLE, Australian exam, or Canadian exam, or Middle East exam. And if you want to settle in Pakistan, you could go for FCPS exam. So, before discussing about the benefits of doing PLAB in UK, let's discuss what PLAB actually is. So PLAB stands for Professional and Linguistic Assessment Board, and soon it is going to be changed to UK MLA. So until it is PLAB, only international graduates will have to give this exam, and UK graduates are exempted from giving this exam. But when it will be UK MLA, then every student will have to give this exam before starting working here in the UK. So if you ask me how much time it will take, the GMC has given a deadline by 2021. They are going to change this exam to UK MLA, but it's not confirmed yet. So let's hope that it's not changed soon so you can go through PLAB because you know the pattern of the exam, everything. So when we talk about living in the UK, UK has a good social care system and there is a universal healthcare system access to everyone who is living in the UK. So you don't have to pay for your insurance to get treatment in the hospital. It's free for everyone who is living in the UK. And when you will start working here and living here, you will see the benefits of this system. While working wise, there are plenty of opportunities for doctors and nurses in the NHS because both of these occupations are on shortage occupation list. So those occupations which are on shortage list, the employer can apply for visa easily and they can start working here very easily, and there is no hindrance in the process of visa and everything. So once you have done your exams after doing PLAB, it's pretty much easier to get job here. NHS is really easy system to integrate into, and believe me, wherever you will start working here, either that trust would be in London, Manchester, or anywhere in the UK, you will have plenty of help available, and you will not find yourself in isolation. One benefit of giving PLAB and coming to the UK is that you can select your own pace. So all of you know that when you go for US MLE, you have to apply for a match. So if you are matched to your specialty where you want to do training, then you can go to USA and start working. But if you are not matched, then you have to apply next year again. But the system doesn't work similarly in the UK. Here, you don't have to apply for training directly. After doing PLAB, you just apply for non-training jobs most of the time. You can start working here as a doctor, see how system work here, get used to the system in 6 months to 1 year time, and there is no rush. You can apply for training afterwards, and it's really easy. And There is another benefit of working in the UK, as I have heard from most of my colleagues and seniors, that if you want to go for surgery and higher surgical specialties in the US, then it becomes really difficult to get into those specialties. I'm not saying that it's impossible, but in US system, it is really difficult to get matched into those specialties directly. But in UK, if you start working on your CV from the first day and you start doing those jobs as a non-training post and apply for training at the right time, it's really easy to get into surgical specialties, and soon you can be a surgical consultant or orthopedics consultant, whatever you want to be. And one more thing, there are lots of KMDC alumni members already in the UK to help you out. So whichever city you are coming to, I don't think so you will find yourself in isolation. You will have plenty of help available. So let's discuss about some demerits of coming to UK and start working here as a doctor. I don't think so there are many demerits of coming to the UK, but if you compare it with Pakistan and US training programs, the training programs in the UK are a bit longer, 7 to 9 years long. If we compare it with Pakistan, 4 to 5 years. If you compare it to US, 3 to 6 year or maybe 7 year. So all in all, you spend more time to become a consultant here. There's just one training program which is shorter, and that is GP training, which just takes about 3 years to complete. If once you are a consultant here in the UK, and if you compare your earning to a US consultant, it might be a bit less. So if it really matters to you, then it's up to you if you decide about that. Let's discuss about costs involved in giving PLAB. But before sitting for the PLAB 1 exam, you have to pass IELTS or OAT. So IELTS cost around 30,000 Pakistani rupee approximately, and OAT is around 65,000 PKR. If you want to go for IELTS option, you can sit this exam in Karachi, Islamabad or Lahore. But if you want to go for OAT, you have to go to Dubai and you have to bear the cost of traveling to Dubai, visa and hotel stay. Then after passing this IELTS or OAT, you have to give PLAB 1. PLAB 1 you can also give in Karachi or Islamabad, and this cost around 230 pounds at the moment, which is roughly 56,000 Pakistani rupees. PLAB 2, it's around 840 pounds just for the exam, roughly 1,70,000 Pakistani rupees. But for PLAB 2, you have to travel to UK, start doing practice before giving this exam, and most of the time you need around 5 to 6 weeks time. The minimum is 4 weeks. So visa cost, your accommodation cost, your academy cost, your traveling tickets, prep to exam fee, everything which you include roughly comes around 2000 to 2500 pounds, which is roughly 4 lakh to 5 lakh Pakistani rupees. But at the end of the day, it just depends upon individual person. So if you have short time like 2 weeks, then this cost will come down. And if you are going to stay more than 4 weeks, then this cost will go up. So it just depends upon your individual circumstances. But all in all, roughly, it will cost you around 6 lakh to 7 lakh rupees for the whole exam if you pass them in your first attempt. Beside giving PLAB, there are some alternate pathways to get GMC registration and start working here in the UK. So if you have done MRCP UK or MRCOG or MRCPA, you just have to give IELTS or OET exam and you can get registered here with the GMC. So the cost of PLAB 1, PLAB 2 then just sets off when you are going for this pathway. As we have already discussed about the costs involved in PLAB exam, let's discuss about some accommodation and travel costs. So when you are going to travel to UK for giving PLAB 2 exam, because PLAB 2 is only held in Manchester, nowhere else in UK, but PLAB 1 is held everywhere. So think about booking early flights for cheaper options. And for PLAB 2 preparation, you have to select an academy where you have to study 3 to 4 weeks before giving this exam. So when you start looking for some accommodations near academies, they are available like 15 to 20 pounds per night, and they could be shared accommodations or separate rooms depending upon your circumstances and how much you can afford. There are plenty of academies available right now. Some of them are London based and some of them are Manchester based. So exam is in Manchester, so if you are going to be in a Manchester-based academy, then it will be easier to do practice until your last day before the exam. But if you are going for a London option, then you have to travel to Manchester 1 or 2 days before your exam just to be on the safe side. So if we talk about the academies, there is one in Manchester, Swami's, and there are many in London like Samson, Aspire, ICMS, and many others, and you can go online and search for these academies. I prepared myself from Swami's, and I'm not endorsing or recommending them, but you research your own and just go for any option, whichever you find best. Let's talk about clinical attachment. If you're a third, fourth, or final year student, there is a good chance that you can apply for clinical attachment here in the UK. And before making up your mind to commit yourself to UK or PLAB, you can see for yourself how system work here. It will be a good learning experience and good exposure to NHS. For applying for clinical attachment, you have to email to a consultant where you want to do attachment in a specific ward or a specific department in that hospital. And most of the consultants' email addresses are available online on the trust website. The main cities in the UK are London, Manchester, Birmingham, Glasgow, Edinburgh, and Belfast, and there are many other smaller cities as well. So you just have to choose for yourself where you want to go for clinical attachment option. Some of the trusts do charge 150 to 200 pound fee, and some doesn't charge, so it just varies from trust to trust. And most of the time, all of the trusts allow you to do 4 to 6 week clinical attachment. You will need an NOC from your parent institution before applying for visa, and visa process will need to be completed by yourself. Some of you might be thinking about help available in the UK. So there are many KMDCN consultants in different specialties and many senior KMDC alumni members present throughout the UK in different cities. So if you are coming here, you will find someone to help you out. And there is KMDC Alumni UK group as well. And if you are coming here or you need advice regarding anything, you can contact me, Dr. Bushra Irfan, or Dr. Sharjila Tariq, or any other member of UK alumni, and they will be ready to help you out to the maximum. Don't shy away, ask questions, ask for help, and we will help you out. Let's talk about some of the study material available for IELTS, PLAB 1 and PLAB 2. Beginning with IELTS, there is lots of internet material which you can search over and start preparing for IELTS. And when I was preparing for IELTS, I searched so many websites, and which I found best were IELTS Liz and IELTS Simon. You can try both of them. The passing criteria for IELTS to get TNT registration or to sit into PLAB 1 and PLAB 2 exam is you should get 7.5 overall and 7 in each band minimum. There are 4 modules basically: reading, writing, listening, and speaking. And if you aim for 8 band in 2 of the modules and you manage to get 7 in at least 2 modules, so it will be 7.5 overall. And IELTS is valid for 2 years, so when you are going to start your prep journey, keep this in mind that when you have given IELTS and got the required score, you should give PLAB 1 and PLAB 2 and apply for GMC registration within 2 years, because if this time lapses, then you have to reappear in IELTS for getting GMC registration. Talking about Pakistan institutes which help you in preparing for IELTS, I don't personally recommend them because I went to one of them and I didn't find useful. But if you want to go for it, it's a personal choice. Talking about OET, they provide some preparation material before the exam and some of the study materials also available on internet. But I'm really sorry that I don't have much data for OET at the moment. So after attending the required band in IELTS or OET, you can sit in PLAB 1 exam. Basically, PLAB 1 is a BCQ based exam, 180 BCQs in total, 3 hours exam duration. It's held 4 times in an year: March, June, September, and November. And June and September during these two terms is held worldwide, while during March and November it's only held in the UK. So regarding study wise, I would suggest that you can go for Oxford's Handbook of Medicine and Oxford's Handbook of Clinical Specialties. These two are really helpful to get prepared for PLAB 1, and there are many Facebook groups and online material of past PCQs available. Passing criteria is usually 60 to 65%, and it is different in each exam. And I personally suggest that 2 to 3 months time is enough to prepare for PLAB 1, but according to each person's circumstances, it can be changed. After completing your PLAB 1 journey, you start preparing for PLAB 2. PLAB 2 is a OSCE based exam. There are 20 stations in total, and each station has got 8 minutes to perform, and there are 2 rest stations. So you have to perform in 18 stations in total. There is 1.5 minutes to rest in between the stations to read the question and understand it clearly. The questions and scenarios are basically from medicine, gynae, surgery, pediatrics, and some from ethics. These are clinical scenarios, and there will be expert actors who will act as patients, and there will be some mannequins as well. It's like a usual consultation as they would like you to do when you will be working in UK hospital while working as an FY2 or SHO in a GP practice setting or NHS hospital. So if you go for that clinical attachment option, it will be really helpful while will you appear for PLAB 2, because you had that clinical knowledge how you see a patient in a GP practice or in a hospital setting. So the passing criteria for PLAB 2 is set according to exam, and it could be different in each day, but in general you have to pass on 2 criteria. There are a number of stations like 10 to 11 which you have to pass out of 18, and there are marks for each station, 12 in total, and for 18 station it's 216. So in most of the exams you have to get 100 to 120 marks in all of these stations to get pass plan. Now coming to the end of this presentation, I will share some useful links with you. My presentation today was just a snapshot of PLAB journey, but if you want to read in detail, you can go for these two blogs, Nasir's journey and Omar's guideline. They are really detailed and they are really helpful in understanding what PLAB is and what it involves. For IELTS preparation, IELTS and IELTS Simon, I would suggest, and these three are useful Facebook groups which you should follow for BCQs of PLAB. So now coming to the end, these are my contact details for WhatsApp, Messenger and Skype. If you need any help, you can text me and I will answer you as soon as possible. I will be taking some questions after this presentation, but after that, even if you need any sort of help or any advice, please contact me. And I hope that you find this presentation useful for your plane journey. Take care and thank you once again.